Well, hello there, future nurses. Welcome back to Med Monday. I hope you guys had a great weekend. So let's jump in and get started. So today we're going to be learning about haloperidol lactate, or Haldol. The functional class is antipsychotic neuroleptic. This medication can be given PO, IV, or IM, intramuscular. It is an antipsychotic. It depresses cerebral cortex, hypothalamus, and limbic system, resulting in decreased activity and aggression. It blocks dopamine-produced neurotransmission at the synapses. And for overdoses, we want to give activated charcoal. This is for oral overdoses, and we want to be sure not to induce vomiting. Now, why do we give this medication? What is the indication? Well, it's for the treatment of schizophrenia, acute psychosis, tics and Tourette's, bipolar, delirium, agitation, and hallucinations and alcohol withdrawal. Contraindications include hypersensitivity, Parkinson's, heart disease, acute stroke, and severe intoxication from alcohol or CNS depressants. Now, we can use this precautiously in pregnancy and breastfeeding. In our geriatric patients, we have to be very careful. In patients with renal or hepatic disease, we want to monitor their renal function and liver function. Patients who have seizures. If patients have prolonged QT segment, we want to monitor that, and we want to give this precautiously because it can cause it to prolong even more. Hyperthyroidism and alcohol withdrawal. Oh, and closed angle glaucoma. So side effects, and remember these are non-life-threatening, and they include pseudoparkinson's, dystonia, tardive dyskinesia, and that is like bizarre movements of the jaw, the mouth, the tongue, and the extremities. Orthostatic hypotension, hypertension, dry mouth and eyes, urinary retention, rash, photosensitivity, and it potentiates the following. And potentiates means to make stronger: CNS depressants, beta blockers, and anticholinergics. So what are our adverse reactions or potentially life-threatening reactions? Those include seizures, neuroleptic malignant syndrome-like reaction, cardiac arrest, tachycardia, QT prolongation, torsades, sudden death, ileus, hepatitis, agranulocytosis, neutropenia, and leukopenia. And if you want to know what those are, I did do a podcast series on those. Anemia, laryngospasm, because it can cause airway obstruction, respiratory depression, and risk for death in dementia patients. So our nursing considerations, well, this has a black box warning for risk for death in dementia psychosis. We really want to give this precautiously or not at all in our dementia patients that are having psychotic episodes. We want to monitor our patients' mood and behavior. We want to establish baseline vitals and then monitor every 4 hours when we initiate treatment. We want to monitor our patients for orthostatic hypotension, and this usually resolves as therapy goes on. We want to monitor our prolactin and our CBC, and now that I think about it, we should be looking at a baseline creatinine for our renal function and our liver panel. We want to monitor our daily weights and strict INOs because sometimes with this medication, patients will have anorexia. They won't want to eat, they won't want to drink, and so we want to make sure that they stay nourished and hydrated. We want to monitor for pseudoparkinson's and tardive dyskinesia. And we want to monitor for serotonin syndrome and neuroleptic malignant syndrome and monitor for QT prolongation. So what are we going to teach our patients and families? Well, we want to teach them, as always with every medication, signs and symptoms of allergic reactions. We want them to understand what orthostatic hypotension is, and that while we're initiating therapy, they need to change position slowly. We want to teach them to not abruptly stop taking this medication, that before they take any over-the-counter medications or herbal supplements, they should consult their pharmacist or their physician. We want them to have very good oral hygiene because they can develop candiditis, and that's a fungal infection in the mouth. We want them to use sunscreen because of the photosensitivity. We want them to report impaired vision, report jaundice because it could be affecting our liver, report muscle twitching, avoid alcohol, and that they may have to have frequent labs drawn. And we want to teach them the signs and symptoms of serotonin syndrome. So that's it for this week. I hope you guys have a great week, and we'll see you next time.